Okay, I think we're good.
Hi there. Welcome to this week's COVID update. Tell me when. Now?
Yeah, we're
Or what
good.
now? All right. Hi there. Welcome to this week's COVID update. This is a new rendition of one that we did about a week or 10 days ago. And you've got Travis and I.
How's everybody doing? Hope you're well. It's exciting times, Tiff, as we're hopefully getting needles and arms this week for EMS providers. So really exciting.
We are pretty psyched about the vaccine rollouts, and we want you to know as much as you can about the vaccines you're getting so that you can make good choices for yourself and so that you can help educate your patients and your families and your colleagues. So if you're taking the time to watch this, I'm guessing you're going to be somebody who is an educator and a leader. And so we want to give you all the tools to do your job that we can. If you saw the last update, you're going to see this one is similar but better because I've been reading and learning. So you'll see some modifications to it, some things that are better explained and some things that are just plain different because I've learned a lot since then. So at the very end, we'll have a little bit of question and answer. But in the meantime, let's talk some COVID. All right, objectives, because we should always have objectives. Remember, if you're taking the time to view this presentation, the idea is that you're going to be able to remember the presentation 6 days from now and 6 weeks from now and be able to teach this material to somebody after that time. If you're only kind of catch and releasing this information in your head for just this little period of time that we're together, then you're sort of wasting your time if you think about it. So as you sit through this, think about committing to this to your long-term memory, committing your understanding to really ownership instead of just a rental. And that way you're using your time in the best way that you can. So we're going to open up talking about masks and microns and why choosing the right mask is really important. We're going to talk about a little bit about traditional vaccines and how they work. And then we're going to talk a lot really about the new vaccine and how that works. And in so doing, we're going to talk somewhat about the immune system and how that works on a micro scale, which is really important and really fascinating. So masks and microns. COVID is about 0.3 microns in size. Now, if you're anything like me, I don't know what a micron is. Well, I do now, but it isn't really common knowledge. So we should talk about what is a micron. Well, a micron is 1/1000th of a millimeter. And what's a millimeter? Some of us use millimeters a lot and some of us don't. A millimeter is that little tiny hash mark on a ruler, the little teeniest one, which is about the size of the end of a sharpened pencil. That's about a millimeter in size. Now, a micron is 1/1000th of that size. So 1/1000th of the size of the end of a pencil, right? A sharpened pencil, not a dull pencil. And COVID is 0.3 microns. So it's about tinier than that, right? Super tinier than that, right? Okay, so it's about 1/10,000th of the size of the end of a pencil, right? It's 3/10,000ths of the size of the end of a pencil if you really want to be exact, but you get the idea. It's really small. Now, why do we care? We care because surgical masks filter out things that are 10 microns in size and bigger, right? So now that we've thought about something that's so tiny, we think about 10 microns, and that's pretty big. But anything smaller than 10 microns goes right through a surgical mask. N95 masks, N100 masks, they actually filter things that are 0.3 microns in size, that are that tiny. So that's why we keep pushing to use N95 masks, right? And I think we ask ourselves, why are nurses getting away with wearing surgical masks? Why are we getting away in public with wearing cloth masks and surgical masks? They're working in well-lighted environments. They have a warning about the patients that they're going to walk into the room and see. If those patients are high risk, they're aerosolizing, they're coughing, they're sneezing, they're anything, what's that nurse wearing? An N95, right? And what do hospitals have? They have air circulation and air cleaning and all of that stuff. What do we have? Well, we have people's bathrooms in which we operate a lot, right? We have their little tiny cramped households in which we operate a lot. We have all their kids sneezing on us with no masks on. We have their family members sneezing on us with no masks on. We are nose to nose with people, and nothing short of nose to nose when you're extricating somebody from between the toilet and the bathtub, right? These are really cramped circumstances. And then we slam the doors and put ourselves in a 5x8 box with these people. So our environment is not the same environment as everybody else's. It's poorly ventilated. We get no warning on when we're going to need to suction or manage an airway or what kind of scene we're walking into, right? Our dispatchers try, but they're never going to be perfect because they can't see where we're going ahead of us. So this is why we really strongly encourage all of our EMS providers to wear N95s on every single call. We understand that there are supply line problems, but we also understand that your mask can be worn on multiple calls and on multiple shifts. I do it in the emergency department. I wear my mask for 12 hours at a shot. I don't take it off, and I wear it for multiple shifts in a row. I conserve that mask because I'm trying to be responsible about PPE. So we all worry about that. Okay. So the mask you want is the mask these guys are wearing, not that other surgical mask. That's not okay. Other things to remember, we need to remember that we can be asymptomatic but contagious. Our patients can be asymptomatic but contagious. We don't want to be the person who spreads COVID from one patient to another. And believe me, EMS providers do. It's been proven. It's happened in multiple systems. Don't let it happen in your system, right? Wear your mask, wash your hands, cover your eyes, right? Wear your eye protection. It's so important. It's important to keep from bringing COVID home to your family, and it's important to keep from sharing COVID from one patient to another and having you be the vector. That's the last thing you want to be doing. Remember that patients can be asymptomatic for 3 days to 2 weeks after exposure and then end up very symptomatic. And we've seen this. People get their exposure, 10 days later, they end up in the ICU. It's crazy, right? So you don't skate. A lot of the information that I'm using for this lecture came off of this YouTube video. So I just wanted to post it and thank the folks that made this because they really were a great springboard for me. All right, how we doing, Travis? Everything making sense? Am I being okay and clear?
Yeah, no, everything sounds good.
All right. Travis promised that he would clear me up if I got wandering. So let's talk a little bit about the immune system and COVID and vaccines. He's laughing because I tend to wander. So there's 3 cells. The immune system is vast, first of all. There's many, many, many cells that make up your immune system. They all have different jobs. But we're going to dial down to 3 core cells for the purposes of this lecture. And they are macrophages, which are just what they say they are. They're big macro eaters, phages, right? Big eaters, they're the macrophages. And the importance of the macrophages is they have OCD. They don't like mess. So when they identify mess, they identify a foreign bacteria or cell debris or virus or anything that's in your body that's not supposed to be there. They vacuum it up and they eat it. And then they do something even more important. And that is that they present that little piece of something, that foreign debris that they found. They take it and they present it to the other immune cells so that the other immune cells know what the enemy is and know what to hunt for. We'll talk a little bit more about that in a minute. We're also going to talk about T lymphocytes or T cells, same thing. And those are killer cells. They kill infected body cells. And we're going to talk about B cells. And B cells do this miraculous thing. They make antibodies. B cells and B lymphocytes are the same thing. Okay, so you can hear it both ways. And those antibodies are key to the way our immune system functions and the way the vaccines work. So keep your eye on the antibodies. They're really amazing. All right. So if you have an average intellect like me, you need a couple of tricks to remember things. The way I remember that B cells make antibodies is I remember that bodies has a B in it. That comes from B cells. If you are brilliant, you don't need this. But if you're me, you do. Antibodies, they come from B cells. All right, now here's the enemy. Now you probably know this on a more complex scale, but for the purposes of teaching, and you're going to teach lots of people about this information, hopefully, the difference between viruses and bacteria is if you made rain out of an antibiotic and you rained it down on the bacteria and the viruses would play in the rain. They would step in the puddles, they would splash, they would dance, they would hang around, and the bacteria would just die. And that's the problem. We can kill bacteria in this day and age pretty effectively using antibiotics, but you can pour all the antibiotic you want on a virus and it doesn't care. So what do? This is why viruses are hard, right? So viruses are not alive. They're just little bits of protein. And what do? They wreak havoc. Unlike bacteria, where we know that there are several bacteria that are actually good for you, they help you digest things, they help clean up your skin, they do all sorts of cool stuff. And we also know that there's some bacteria that are bad for you, that make you sick. We have yet to identify a virus that's good for you. It's too bad. They're evil little buggers. What do? Once they're in you, the viruses infect your body cells. Now, for the purposes of this lecture, a body cell is going to be this big box looking thing. Now, that's not what a body cell looks like, but as you will see soon, my art skills are not what they could be. So I had to pick things that I could draw, and I could draw a box. So the box is the body cell. That's this. Okay. Once they're inside your body cell, they hijack a little mechanism called a ribosome. Now that's just a part of a cell. It's a little manufacturing plant for proteins. Ribosomes make proteins. So the virus hijacks the ribosome, and the ribosome makes more viruses. Isn't that cool? Well, it's cool if you're a virus. It's not cool if it's you. And you'll notice that these little viruses have little bits on the outside of them that mark them as viruses. When they infect the body cell manifests those little bits on its outside so that somebody can see it's sick, right? And that's part of how cells work. Really cool. Okay. So what happens then? Once the virus makes a lot of itself in body cell, the body cell just explodes because it can't hold all those viruses anymore. And that's what's happening here, where this body cell just explodes in little bits. And what comes out? All those little new viruses. And what do? They infect more body cells, make more of themselves, infect more body cells, make more of themselves. How do we survive this, right? We know that we survive some viruses. We've survived the flu all the time. We've survived the common cold. And we know that there's lots of viruses around. Think about it. We know lots of viruses. We know polio and measles and mumps and rubella and Zika and Ebola and flu, right? Colds, adenovirus, enterovirus, they're all over the place. Most of them don't cause too much havoc. Some of them really do. So how does all this work? Well, in our immune system, we have some heroic cells. And these are the cells we talked about before a little bit. These are B cells. They're the ones on the left there of your screen that look like a bee, or they're trying to look like a bee if you're me. There are T cells. They look like a tank, or they're supposed to. And there are macrophages. That's these big, hungry looking guys on the right-hand side of your screen. So here's a macrophage. He's identified a virus. He knows that that's foreign because he knows what's supposed to be in his body and what's not. And what does he do? He grabs that virus and he eats it. So here's the little virus inside the macrophage. And he digests that virus. And when he does that, it looks like these little pizza slices inside the macrophage. Okay. What does he do with those pizza slices? He presents them to the other immune cells. In this case, it's a T cell. Now the T cell knows what to look for. It's going to look for the virus that the macrophage presented to it. It's looking for everything that looks like that little bit. And when it finds an infected body cell that has those little markers on it that the macrophage showed it, it destroys that sick body cell. Okay, there's the little markers. And these are the little bits of sick body cell that are all blown apart by this happy T cell doing its job. Okay, so that's how T cells work. B cells do the same thing. They have the same interaction with a macrophage. Macrophage, again, ate up that virus. Here's the little bits of virus inside. It takes one of those little bits and it shows the B lymphocyte. And the B lymphocyte doesn't directly go after the viruses, but what the B lymphocyte does is it makes antibodies. And that's what these little Y-shaped looking things are here. And each one of those little antibodies knows what to look for. It's looking for that virus that the macrophage showed the B cell. So they are programmed, and they're very specifically programmed to go just for that and for nothing else. Okay. Once the antibodies are released, they look for viruses, and that's what these round things are the representation, my representation of viruses. And when they find the virus, they can opsonize the virus, which means that they just flag it and make it more attractive for other immune cells to kill. They can neutralize the virus, which means they stick all over the outside and they keep that virus from infecting other cells because it's too big and too knobby to get inside the other cell, the body cells, and do its thing. So it gets knocked out of circulation, doesn't do anything. And it can also agglutinize viruses, which means that it can stick them all together in a big clump. And then your lymph nodes and your spleen can take them out of circulation so they can't do any harm. So why do I keep saying this is miraculous? This is miraculous because it knocks out virus before the virus gets in your body cells, which is awesome. So now you have your immune system working on two ways. Once the virus gets in your body cells, the T cells destroy those infected cells. But before it can get into your body cells, whatever the antibodies can get a hold of gets knocked out of circulation. Okay, so some of it obviously is going to defy those antibodies and slip through and get in your body cells, but whatever that can get coated by those antibodies will, and that gets dropped out. So that's how your natural immune system works. This is when somebody sneezes on you and you take your virus in yourself. Okay, so let's have a quick review. What does a macrophage do? Remember, macrophages have a little OCD. They like to clean up. So they eat pathogens, and those pathogens could be viruses, they could be bacteria, they could be cellular debris. Pathogen just means a foreign thing that can cause you harm. And that's what macrophages eat up. And then what do? Well, you're right. They present parts of those pathogens to T and B cells. Okay, in this case, it's going to be a virus. What does a B cell do? Well, B cell makes antibodies, right? And those antibodies can opsonize, neutralize, or agglutinize viruses or other pathogens before they can actually enter your body cells. So that's pretty awesome. Okay. What does a T cell do? Well, whatever pathogen actually gets in your body cells, the T cells kill those infected body cells. So obviously this system is not perfect. Some viruses are so powerful that even though your immune system ramps up, it doesn't do the job well enough to save you. And that's what happens with COVID and other viruses too. So now that we've reviewed, let's think a little bit about how traditional vaccines work. So this is the flu vaccine, polio vaccine, the MMR, all those things that you've probably gotten. So the traditional vaccines, we either kill the virus or we chop it up into little bits and we throw it in some sort of little solution, and that's what you get. Okay, you either get dead virus or you get little bits of virus. And then what happens? The macrophage takes that virus, those little bits of virus or that dead virus up, shows a T cell, shows a B cell, right? The T cell goes hunting, the B cell makes antibodies, and those go hunting. Kaboom, there go your sick body cells. And snap, those go on, the antibodies go on those viruses and take them out of circulation. Okay. So that's how traditional vaccines work. And now the moment you've been waiting for, how does the COVID vaccine work? Well, this is fascinating stuff, I think anyway, but I'm easily fascinated. So in Wuhan, when this whole thing started, the scientists did a pretty amazing thing. They worked out the genetic code for the COVID virus, and they published that genetic code worldwide and made it free for everybody. So scientists across the globe literally have been working on a vaccine ever since the beginning of the year. And what they did was pretty neat. They figured out that the COVID virus has a fairly unique feature, and that's this spike. Notice this virus has these big spikes on it. And so they identified this, they called it a spike protein because that was pretty handy. What does the spike protein do? Well, you know how chicks, when they are before they're hatched, they have a little egg tooth on the end of their beak so that they can get out of their egg? The spike protein works similarly, except for sort of the opposite. It helps the COVID virus get into your body cells with startling efficiency because it has this big drilling spike on the top of it, okay? And so it goes burrowing into your body cells super fast. What the scientists did is they figured out the code for just that spike, not the virus. They knew the virus code, but they figured out how to just snip out the code for just that spike and how to make that. They manufactured it, okay? The code is called mRNA. And so what the scientists did is they made mRNA, little codes, for the spike protein for the COVID virus. And that's all it codes for, is just the spike, not for anything else. Okay, so what do they do with that? They take the mRNA for the spike protein, and they fold it around it, a little lipid bilayer, so a little jelly fatty coat that's very similar to the cell walls of your body cells. And then they put it in solution, and that's your vaccine. It's a whole bunch of little mRNAs, okay? So that's what I'm going to get injected in my arm soon. They just ran out of mRNA or out of vaccine at my hospital. They promising me a shot in the next day or two. I'm pretty excited. So this mRNA and its little jelly coat gets inside your deltoid muscle and in your lymph tissue and your blood, and it goes into the body cells. And what does it do? Once it's in there, it finds the ribosome, which again is the protein manufacturing plant in your cell. And when it goes to the ribosome, it gets red, and the ribosome then manufactures what it's told to manufacture, which is just little spikes. That's it, just spikes. Your cell doesn't know what to do with those spikes. So it packages them up in a little cellular organ called a Golgi apparatus and ships them out in something called an endoplasmic reticulum. If you've taken cell biology, those things are familiar to you. If you haven't, then don't worry about it. What you need to know is the cell ships out all those little spikes outside the cell. And they go off into the interstitial space and the blood and wherever. They just go. But they're messy, right? Now you've got a whole bunch of little spikes lying around doing nothing. And who has OCD that you've learned about? Well, of course, it's Mr. Macrophage, right? So what he does is he vacuums up just those little spikes. And then you know what he does. He shows those little spikes to the B cells and T cells. And then the B cells and T cells go out and destroy anything with a spike. And that is the COVID virus. That's what has a spike. Nobody else has a spike. It's just the COVID. Good stuff, right? So here's the little spikes inside. That's a little spike that the macrophage is showing the B and T cells. So what happens? The B cells make antibodies, and the antibodies opsonize, right? So they mark the virus so it's more attractive to the other immune cells. They neutralize so they can actually coat over the spikes So then the poor little COVID viruses are trying to get into the cells. And they're like, woo, let me get in, bonk. Let me get in, bonk. They can't get in. So they just get knocked out of circulation. Or it glues a whole bunch of them together, right? Agglutination, and then your spleen and your lymph nodes can get rid of them. Okay. The T cells also recognize that these are infected body cells. They've got spikes on them. They say, that's not all right, right? And they do what they do. Boom. There goes the body cell that's infected. Hopefully there are not too many of those, though, because you have antibodies and they're ready to go, right? The T cells are all tuned up by this vaccine. The B cells are all tuned up and they've already made antibodies. They're already ready to go attack things. So the whole idea is that those antibodies take out most of the virus before it infects you. And the few little viruses that get through and infect your body cells, the T cells take care of that. And that's it, man. Okay. So let's review for a minute, and then we're going to have some questions back and forth with Travis and I at the end that hopefully address things that are on your mind, because we know that there's lots of things. All right, so here's the cast of characters. Just to remember, these guys are the macrophages, and B cells, and the T cells. This is the vaccine. And this is just a reminder down here that there's lots and lots of other immune cells that we can introduce you to some other day if you're interested. How big is the COVID-19 virus, right? Remember, this is where we talked about masks and microns. And we know that the COVID-19 virus is 0.3 microns in size, which is so small that it cannot get through your N95, but it sure can get through a surgical mask. And that's why N95s are so important. Also, remember to wear your eye protection, because this can get in through your eyes, whether it's because you rub your eyes and you weren't thinking about it, or because the patient breathes in your eyes. Either one of those things can infect you. No good. Okay. What does a B cell do? Right. B cell makes antibodies. Excellent. Those antibodies are so important because they can knock virus out of circulation before it even infects you. And what does a T cell do? The T cell, you're right, kills infected body cells. So whatever few body cells you have that do get infected, the T cell takes care of them. And what does a macrophage do? Remember, they're the big eaters, right? So they are the cleanup crew, and then they're the antigen presenting cells, right? They take those antigens and they present them to the T and B cells, so that the T and B cells are fine-tuned and they know right exactly what they're looking for. How do the new vaccines work? We introduce mRNA, messenger RNA, that codes just for the COVID spike into your body. Cells take up that mRNA, and the ribosomes in the cells make just little spikes. The B and T cells learn to identify just those spikes, and then they kill off the infected cells, and they opsonize, neutralize, and agglutinize any viruses they find. Who are these characters? You know these guys well already. Macrophages, B cells, and T cells from left to right. Okay. That's it. We did it. Not so bad, was it? Even though you had to.
I don't think so.
I didn't think so either. Let's talk about some questions that we've heard about.
Yeah, because there's a lot.
What you got, Travis?
There's a lot out there. There's a lot of information flying around, and some of it good, some of it bad. So, I think one of the big concerns is, that this is, as far as vaccines go, this is new, right? This mRNA technology, but also that it was you touched on how they've been working on this all year, since they released the coding, but people still feel like it happened quickly, right? This came together quickly, and that actually concerns them. I know on the government and regulation side, a lot of red tape was pushed out of the way, right? or cut through. But, what would you say to those people that are concerned about how quickly this was kind of brought forth, and those who are, skeptical about this mRNA technology?
So there's a couple of reassuring things about this to me anyway. And that is that the science didn't dream up this technology this year. This has been hanging around for a while, but studies had been underpowered and underfunded until this year when it became so important to power them and fund them, right? So this isn't exactly new stuff that we just came up with on the fly. This is stuff that's been around, but we never really had the money to prove it out and make it work. The other thing that I think is reassuring is that one of the big challenges to making these things work is that the mRNA that they use is very unstable. So it breaks down super fast. And one of the big challenges that they had was keeping that mRNA stable enough so that it would make enough spike protein before it just dissipates, that it would actually work. So this is not mRNA that you're stuck with for the rest of your life. It really has a short lifespan, and once it does its thing, it goes right away pretty quickly. So this isn't something that takes over your world, right? What else you got?
Yeah, no, that's good. I think that's important because um, one of the other bits of information out there is this is going to alter somebody's DNA, right? And so I think the way you
Right,
just explained it is pretty clear, and it's important to note that that's not the case.
right. This mRNA does nothing to your DNA. It just hijacks your little ribosomes, which are protein manufacturing factories, and then it dissipates, it goes away.
Mm.
So it's just a temporary state that you actually manufacture those COVID spikes.
So so Tiff, what about side effects? I mean, we know that there's probably some minor side effects that people experience. From what I understand, especially with the Moderna product, that it's after the second dose in a lot of people. But what did you read in kind of the reports, and what have you heard about as far as side effects go?
So you should expect to have the same effects that you would normally have when your immune system ramps up. So you'll recall that when you start getting sick, when you're catching a cold, you're achy and you're tired and you get a little runny, nosy, sore throaty kind of stuff. That's actually your immune system ramping up to protect you. And so it's very common that we see those sort of things after we get a flu vaccine or any vaccine, right? If you have kids, you've noticed that your kids get sometimes even a little fevery and achy and irritable after they get their vaccines. That's because their immune system just had a big workout at the gym. And we've all had a big workout at the gym sooner or later, and it makes you achy, right? Your muscles ache. Well, your immune system gets the same sort of thing. When it gets a big workout, you know about it. So you can expect a little bit of that with the first dose of your vaccine. But as you would expect, knowing what you know now after this lecture, when your immune system has already had one dose of the vaccine, when the vaccine comes again 21 or 28 days later, depending on which one you get, your immune system is going to identify it, and it's going to ramp up faster and harder and angrier, and it's going to fight that stuff, right? It's going to see those spikes and it's going to ramp up even harder. And so you're probably going to be a little sicker. You're probably going to feel pretty awful for a day. Um, Likewise, if you have had the COVID-19 infection before, you're probably going to feel much worse than the colleague sitting next to you that hasn't, even on the first dose of the vaccine, because your body, your immune system is going to have some identification of those COVID spikes. So it's going to ramp up angrier, bigger, and meaner. And that's okay. That should be actually reassuring to you that your immune system is working well, as much as you're going to feel kind of yucky.
So you bring up a good
Oh,
point. If you had COVID,
anaphylaxis. You were going
oh yeah,
there too.
oh yeah.
That's
w-
right.
as far as what, allergies?
So
Is that
finish
what?
that thought. Sorry.
Oh no, it's okay. So those who have had
Yeah, we were
COVID,
anaphylaxis too.
is
Mhm.
that, if they've had COVID, should they consider getting the vaccine? What if they've had antibody treatments during that sick period? I mean, what do we know as far as those who have had COVID?
Good. So the question comes up pretty commonly. If I have had COVID, am I not immune? And why would I need to get the vaccine? Well, the reason that you should seriously think about getting the vaccine, even if you've had COVID in the past, is because we know that viruses mutate, right? And we know this from personal experience. If you look at a patient at the beginning of the flu season and you look at a patient that's flu positive at the end of the flu season, those patients often look a lot different from each other because they've gotten totally different strains of the flu. So if you've had COVID, your immune system is, I learned to identify just the strain that you've got, but maybe not the strain that you're exposed to today. And this is why we think this is why, anyway, people have gotten COVID twice. And sometimes even 3 times. There's a few cases that we know about where people have gotten COVID and then gotten it again and then gotten it again. Well, how is that possible if you have a healthy immune system? It's possible because the COVID mutates. Okay. Now, this COVID vaccine, because it codes for just the spike, will cover all of the mutations that we know about, including, as far as we know, the new one in Great Britain that we're talking about in the last couple of days on the news. They're watching these mutations really carefully because if the COVID mutates the shape of the spike or it mutates so it doesn't have the spike at all, then we're dead in the water and we got to come up with a new vaccine. That's one of the reasons that it's so important and that there's such a push to get vaccine out and get as many people vaccinated as fast as we can. So as we can, as fast as we can. There we go. I missed a phrase. Think about this. The flu vaccine comes out every year, and less than 50% of the population, probably less than 40% of the population gets the flu vaccine. So what happens? Well, immediately in the other 60%, people are contracting the flu. And as soon as they contract it, right, person after person gets infected with the flu. And so every time that flu hits another person, hits another person, hits another ribosome, makes more of itself, it evolves, right? It mutates. And so the flu vaccine that we give people often doesn't cover the flu for very long because the rest of the population is busy mutating the virus. Now, if we can get this COVID virus under control by vaccinating vast numbers of people, then we could kill this. We could actually get a hold of this and not go through this again. But we got to do it faster than the COVID mutates out that spike. So we got to do it before that spike goes away or changes shape. And that's why it's such a big deal to get this vaccine out and get people vaccinated, as many as we can, as fast as we can.
So I want to go back to the side effects and in
Yeah.
particular allergies. People who have allergies to whatever, or maybe they have a history of going into anaphylactic shock. What do we know? Because when I believe um, in Europe, I forget where it was when they first had started to administer the Pfizer doses, they had a couple of cases of allergic reaction. What do we know in that regard? I hear that as a common concern. Some people who might be allergic to some sort of food, or people who've had reactions to previous vaccines.
To the best of my knowledge, we haven't figured out what these people have in common as far as a past allergen goes. If you know that you're someone that gets allergic reactions commonly to vaccines, you should probably talk with your allergist or with your primary care doctor before you get the COVID vaccine, as you should with any vaccine. If you know that this is something you're predisposed to, be a little more cautious. That said, after conversation with your doctor, you may decide to get the vaccine anyway, because we can treat anaphylaxis, right? You go, you get some epinephrine, you get some Benadryl, you get some steroids, and you get better. and things are okay, as opposed to COVID, which we have no treatment for, not really any good treatment for. So that's a problem, right? But that's shared decision making with your doctor. That's when the two of you need to be really a team, and not one person. The two of you need to think through this together and share a brain and make good decisions for you. And that's an individual choice.
Yeah, no, I agree. Um, Adverse events. I wanted to talk about adverse events because I saw um, Dr. Cushman put out a nice little presentation, and some other people have talked about it. In the Moderna phase 3 trial data that's been published, I believe it was roughly around 1% of people, whether they were in the placebo group or the vaccinated group, had an adverse event. Um, but I think it's important to note that those aren't necessarily events directly related to their participation in the program. And one of the things he pointed out was the age of some of these participants, people who already have underlying medical conditions. So if I'm in that study and I have an MI, they're following me throughout that study, and if I have an MI, completely unrelated to my participation in the study, that gets marked down as an adverse event. So I think that's important for people to understand when they're when they're looking at that data.
Right. If you ever see a study, especially a study of medication that has no adverse events listed in the study, that's a poor study, right? Because if you're running a good, honest study, then you record any adverse events that the patients have after they get the vaccine or the medicine or whatever it is you're studying. And that includes things that are coincidental. So when you're worried about the adverse events that are published, sit down, read the study, and find out what those were. Okay. If those are lots and lots of cases of anaphylaxis, then you should be worried. If those are one person had a stroke and another person had a heart attack and the other one stubbed their toe, then you can be more reassured. In the studies that we've seen from Pfizer and Moderna, the adverse events were more of a grab bag, right? More like the latter, although there have been a few cases, very few, but a few for sure, of anaphylaxis. And so that's why we were talking about that earlier.
So Moderna, Pfizer, two products now, mRNA vaccines that have emergency use authorization. Uh, Same technology. So are these interchangeable? That's a common question. Um, they are not interchangeable, right? This is not something where you can go get Pfizer and then kind of shop around for a Moderna dose as your second dose. At least not currently. Is that correct? That's your understanding?
That's correct. If you get
Okay.
the Pfizer straight up, your second dose should also be the Pfizer, and that's 21 days after your first dose. And if you get the Moderna first, you should stick with the Moderna and get it 28 days after your first dose. Now, that said, they're really using the same mRNA. There's a little difference in the lipid coat. There's a little difference in what the solution is that they're using to dilute it in. But if for some reason some sort of catastrophe occurred and they had to shut down the Pfizer plant and your only choice was to get the Moderna and there was no other way, it would probably be fine. It really would. So don't panic, but do try and stick with what you started with.
Hmm. Well, those were the common ones that I had, Tiff. I don't know if you have any other ones that you've heard, amongst the chatter, online or at work or wherever. But um, those are the ones I thought that were common and really important, and especially at a time where we're now getting to this part of phase 1 in New York where our people are going to be vaccinated, and some
Absolutely.
already have started, but at the same time we're finally getting doses out throughout the state for EMS, which is exciting.
Yeah, we're psyched. There was one other thing that I remembered we wanted to touch on, and that was There has been some guidance about if you have had COVID and you were so sick that you got one of the monoclonal antibodies, so anything ending in MAB, okay, then the guidance is that you should wait for 90 days before getting the vaccine. If you got regular antibodies, so convalescent plasma, or you got any other treatment for your COVID-19, but did not get a MAB, no monoclonal antibody treatment, then there's really no guidance on whether you should get the vaccine or not, or when. So that's something that, again, you need to team up with your own physician, put your heads together and figure out what's safe for you.
Yeah, good stuff. Yeah, I'm glad you remembered that.
Just remember.
I just want to say this is, first of all, I want to thank you, Dr. Bombard, for doing this again. And, I just want to let everybody know this is not us trying to cram vaccines down your throat. We want to make sure that you're educated, that you're getting good information, so that you can make a decision for yourself and for your families. I'll tell you that I am going to be taking one of these, whichever one I'm offered. I don't care which. And it sounds like you are as well, Tiff. But again, this is not
Absolutely.
peer pressure on our part by any means, but we do want to make sure that you're getting the right information to, kind of process and make a decision.
Absolutely.
So,
If you have questions for us, please get in contact with either one of us. We're easy peasy to get a hold of. My email is tbombard, BOMBARD, MD @cbph.org. And Travis, what are you?
THOWE at mountainlakesems.org.
We are very happy to answer your questions. We'll probably do this update live again in the near future so that it's a little more dynamic. But we wanted to have this one in the can so you can watch it at 3:00 in the morning between calls if you want. Please be safe.
All right,
Care.
guys,
Get a
take
hold of
care.
us if you
Okay.
can. Or if you
Thanks, Tiff.
Thank you. Happy holidays.